Welcome back to Focus on Health. In case you're joining us right now, our topic today is prostate cancer. So, Dr. tell us about the investigations. How do you work up the investigations once someone is already diagnosed with prostate cancer?
So, once we have a biopsy confirming that a patient has prostate cancer, like I mentioned earlier, prostate cancer tends to spread a lot to bone more than any other site. Most solid tumors spread to the lungs, the liver. But prostate cancer has this unique habit of spreading to the bone. If possible, we do what is called an MRI of the pelvis, just to look at the prostate, the local extent. Is it in how big is the mass in the prostate? Is it invading the bladder and the rectum, which are the surrounding organs? Is it invading another small organs we call the seminal vesicles, which are also found just below the prostate? Because all that helps with what we call staging. Then there are this, what we call the lymph glands. We have them found everywhere, the neck, above the collarbone, the armpit, in the chest, in the abdomen, and even in the pelvis. And sometimes the ones that are found in the pelvis or just around the organs inside the pelvis, such as the bladder, the rectum, next to them, the prostate cancer can spread to them as well. Again, that helps with our staging. Finally, especially for patients who have a high PSA level, and a high PSA mean like more than 20, or they have symptoms, maybe they have back pain, severe back pain. We do what is called a bone scan. This is a unique test where they injected with some radioactive material. Then we take a scan to look at the entire skeleton. We want to see whether the cancer has spread to the skeleton, if it has, or to the bone. All that helps with our staging. So finally, we will stage the patient because we have from stage 1 up to stage 4. And the staging is what determines the treatment that we will give. So patients who have early stage disease, we have so many options in prostate cancer. We have surgery, we have radiation therapy, we have hormonal therapy. Hormonal therapy, because prostate cancer, especially what we call prostate adenocarcinoma, it is a hormone-dependent cancer. It needs the male sex hormone, testosterone, to grow. So, and it is actually, when I said that prostate cancer is the commonest cancer we see or rather it's commoner in old men than in younger men, we're talking about that prostate adenocarcinoma. So when we see the biopsy confirming, yes, this is prostate adenocarcinoma, we stage the patient. Then we tell the patient these are the treatment options available. A patient may opt for surgery. Some patients may say, I don't want surgery because of the complications of surgery. Some patients may say, we want radiotherapy, where we use high energy X-rays to treat the tumor. Some patients the ones who we do radiotherapy, we normally combine with hormonal therapy. Surgery, normally we just remove the prostate and the seminal vesicles and what we call the lymph nodes. It's a surgery called radical prostatectomy. And then again, that will even help with further staging because it will tell us the extent of the disease. MRI may have said the lymph nodes were involved, but because they'll have removed the lymph nodes, they take them to the lab. The doctor in the lab, the pathologist will look at them and say, no, they were not involved. So that will actually confirm the stage. Interestingly, because prostate cancer is what we call, it's an indolent cancer. It's a slow-growing cancer. Sometimes we may get a patient maybe who is 90 years old with a stage 1 prostate cancer and may have maybe multiple other diseases. Remember, the older you are, the higher the chance of even having other diseases like high blood pressure, diabetes, kidney disease, strokes, heart attacks. So we may find a patient who has what we call multiple comorbidities with a very early stage prostate cancer because we classify it according to the risk. We have what we call very low risk to very high risk. In such a patient, we may even opt to just do follow-up. Yes, they have prostate cancer, biopsy has confirmed, maybe PSA was 7 or 8, but they have stage 1 prostate cancer. And then they may be taking many other medications. We may tell them, let us just follow you up. Every year we'll be checking your PSA. We may do another biopsy to check if the cancer is becoming more and more aggressive. But we tell the patients these are the pros and cons. If we decide to follow you up and not treat, maybe in that 1 year follow-up, the cancer the biologic behavior may change, it may become more aggressive and spread. But also, if we do not give you treatment, we are going to minimize the side effects of this treatment for you at this time. But prostate cancer is like one of the few, it's the only cancer we can actually do that, where we can do what is called watchful waiting. We do not treat. And it's not all patients. It's only a few patients who present with very early stage and very low-grade disease or very low-risk disease.
So, Doctor, if I'm getting you correctly, if one is diagnosed early, does that mean that you can actually get a cure are there survivors of prostate cancer?
We do. We have prostate cancer survivors, even the ones who presented, say, with stage 3 disease. Because they come, we have staged, we found the, fine, we staged and we found that whatever stage they were in, and the patient says, I do not want, like in this center, for instance, here we offer chemotherapy, hormonal therapy, and radiation therapy. We don't do surgery. Surgery I have to refer to a specialist called a urologist. So a patient says, I just want to, I opt for the option of radiation therapy. So we'll combine radiation therapy with hormonal therapy. Radiation therapy is given daily for about 7.5 weeks, every day except weekends. And like I said, we're using high energy x-rays. We love that. Most of us have done an x-ray one time of our lives, maybe for the chest or a bone or whatever. Here we're using what are called high energy x-rays. We focus them on the prostate or the pelvis so that we also treat those lymph glands. And then we treat for about 7.5 weeks to completely eradicate the treatment. At the same time, we're combining with hormonal therapy, which comes in the form of tablets and an injection. The injection is given every 3 months. We inject on the tummy. Now, the main purpose of this injection, like I said, we want to reduce the levels of the male sex hormone, the testosterone. So literally what we are doing, we do what is called chemical castration, because you're going to reduce the testosterone levels to very low, nearly undetectable levels. At the same time, so the testosterone level will drop, and as we're giving even the radiation therapy, even the PSA level will drop. Even patients who've come with PSAs of even 100, they drop down to even less than 0.01 because it responds very well to treatment. After they finish the radiation therapy, which is nearly 2 months because 7.5 weeks or 7 weeks minimum, they continue with the hormonal therapy. And the duration of the hormonal therapy, it can range from 6 months to even 3 years depending on the stage. This treatment has side effects. We cannot escape the side effects.
For the radiation or chemotherapy?
All of them. Let me start with the radiation, because where we are treating, in front is the urinary bladder that carries the urine, behind is the rectum that stores stool. So initially, as we start treatment, the patient is not going to experience anything because we are giving them a small dose of radiation. But maybe from around the 3rd, 4th week of radiation, the patient will start complaining when they pass urine, they have pain, they may see blood, they may have frequency of urination. At night, they may be waking up a lot. When they go for a long call, they may have diarrhea, stool may have blood or mucus, or it may be painful. And we normally have medications we give to manage these side effects because we do not want the treatment to be interrupted.
Dr. You've already talked about some of the side effects of these treatment methods. So let's go to hormonal therapy. Is it true that it actually causes erectile dysfunction?
Yes, it is true. Because when you give hormonal therapy, we normally give to suppress the male sex hormone testosterone. And it's the one responsible for sexual activity, including libido in men. So when you give a man that injection, it suppresses about 95% of testosterone levels in men because we want it to literally stop feeding the growth of the cancer. And while the man is going to respond very well and the cancer will be well controlled, the side effect that's going to cause, it's going to cause erectile dysfunction. It can even cause impotence. The penis can shrink, can become smaller. The breasts in men will become bigger, what we call gynecomastia, and sometimes they can even become painful to an extent where we have to give a man radiotherapy to ease that pain. Yeah.
Now, Dr. Let's head down to the prevention methods. How do you prevent prostate cancer?
Preventing prostate cancer is because we do not know the cause, like I said. So it's quite a tough question that you're asking. So we may tell a patient, or rather members of the public, cut down on like red meat intake. And remember, red meat is not just cutting down to lower your risk of prostate cancer. Red meat, high consumption of red meat has been linked to other illnesses as well, colon cancer, cancer of the rectum, these other non-communicable diseases like hypertension. So it's not just an issue of what you call gout. So it's not just an issue of just reducing to lower your risk of prostate cancer. Reducing your intake of red meat is going to help you reduce the risk of developing other diseases. And please note, I'm saying reducing your risk, not preventing. But the good thing about prostate cancer, it is a disease that we can screen. So we'll advise men from age 50 and above, start going for regular screening. See your doctor, see your physician, see your urologist if you have one. he can do the digital rectal examination and request for a PSA, so that if the disease is found early, it can be cured.
What would you tell, people living with prostate cancer, rather the family and friends, how do they cope, with the management of prostate cancer?
I would tell them, when found early, it's a curable disease. Again, even when found late, like when it has spread, we've had patients even with prostate cancer diagnosed that has spread to bone, and even 4 or 5 years later, they are still alive. On therapy, yes, and even experiencing the ravages and the side effects of treatment, but still alive because it's controlling their disease. We can't predict who will respond and who will not, because unfortunately some patients we found with prostate cancer, we've started them on treatment, but a year later they have passed away because sometimes the disease tends to become very aggressive. But there's still hope. Even if they have metastatic or cancer that has spread, there's still hope for them. And for the family members, we tell them, please understand the side effects, especially for the hormonal therapy. They're not easy on men. They're not very easy on men when they start losing their sexual function. Another side effect is that they become very irritable. Not because they want to, it's just a side effect of the hormonal therapy. So we tell them, please understand, when you have a parent or when you have a spouse or a parent or a sibling with prostate cancer who is undergoing treatment, just support them and be there for them.
Thank you very much, Dr. It's been quite an informative session.
Thanks for inviting me, Michelle.
So we've come to the end of our show, and there you have it from Dr. Prostate cancer has a silver lining. I've been your host, Michelle. I will leave you with the healthy segment. Until next time, stay healthy.